Welcome to Tell Me More About Medical Technology. My name is Michael Rudisil, but call me Rudy. I'm an assistant director in the Duke Career Center for the Healthcare and Biomedical Sciences community, and I have a very special guest joining me today. This is Dr. Eric Richardson over at BME, and without me just going and rambling any further, I'm going to allow him to introduce himself. If he doesn't mind sharing a little bit about his background, his education, and what has led him to his career today.
Yeah, glad to. Thanks, Rudy. I'm excited to chat today. So, my background, I was a mechanical engineer. I started out my career in mechanical engineering. Then I did my PhD in biomedical engineering out in Minnesota, of all places. And then actually, when I was finished with my PhD, I decided I would never go into academia. So was kind of done with that and ended up going out to California and working at a company called Medtronic. It's a very large medical device company. Actually one of the biggest in the world, and had a lovely experience working in industry. So was involved with cardiac devices, so heart valves mostly, but did things with pacemakers and all sorts of stents and things like that. Was involved with some acquisitions of companies, some startups, but about 5 years into that, really realized I missed teaching. So left the corporate world and came back into academics, and was originally at Rice University for about 5 years.
Go Owls, yeah.
Yeah, there you go. I have this interest and continue to have an interest in global health. So I went to Rice to start a program in global health med tech called Global Medical Innovation. And then I also ended up starting what we call a biodesign program, the Texas Medical Center biodesign program, and started a few companies with students, had a lot of fun. And about 7 years ago, was tapped on the shoulder by Duke to come out here, and have really enjoyed it. So I currently run the Design Health program at Duke, which is a program between medicine, engineering, and business and nursing, and we bring those folks all together and we design products in medicine. And I also teach a bunch of courses in BME, still involved with some startups, but I'm really more of a kind of an industry-focused professor and a teaching-focused professor.
Excellent. And that's the direction a lot of our students are headed. It's how do I find out how to get there, and what does it even mean? I think I often have conversations about, well, what is a position title, or what is this industry title as a whole? And I think that's kind of my next question for you is, if you were explaining medtech to someone, how would you describe it?
Ooh. Good question. I will say right off the bat that a lot of people have different definitions of medtech, and also depending on what country you're in and how your local kind of industry or economy divides companies up. But I define medtech as basically the traditional engineering disciplines applied to medicine. So things like mechanical and electrical and chemical as they apply to medicine. That's distinct in my world from biotech, which tends to be kind of biological approaches to medicine. So things like therapeutics, we talk about stem cell or gene therapy approaches. That's all kind of in the biotech world, vaccine development. And then there's also the digital health world, which sometimes is kind of at least clumped together with medtech, but sometimes it's different. That's kind of everything software related to healthcare. So medtech ends up being mostly medical devices, diagnostics, imaging, things like that, as it relates to medicine.
Excellent. What would you say some traditional pathways into that? I know you mentioned your background was mechanical, and then you found your way over to Medtronic.
Yeah. Do
you mind sharing a little bit about traditional pathways students might take?
Yeah. Most just because of the numbers, BME is actually a pretty recent discipline. So when I went to my undergraduate education, there was no BME department at my school, and many schools don't have BME departments. So predominantly it's a lot of just traditionally trained engineers, usually in the big disciplines, mechanical and electrical, that want to work in healthcare. You do get a lot of people from clinical backgrounds, so nurses and doctors. You also get people who are purely kind of business trained, so people who want to do kind of the marketing or needs finding or implementation aspects. But yeah, for engineers, traditionally it's mechanical, electrical, and then biomedical more recently, that end up going and developing these products in medtech.
Okay. And these products, you mentioned a couple different things, from diagnostics to the actual devices themselves. Where are you seeing these in healthcare? What, as a part of the ecosystem, how are they playing a role in that?
Yeah, that's changing over the years. Historically, it's been medical devices that are kind of high-end in-hospital medical devices, things like implantable pacemakers and heart valves and things along those lines, and then a lot of the equipment that surrounds the patient in the hospital. But that's gotten more and more broad as we've kind of done more in clinics, and now recently more at home. So there's this expansion of healthcare technology that started, really in the operating room, but then has expanded to clinics. And now, you think about, wearables and monitoring people at home. We have come to the realization, and there's obviously still a place for expensive kind of in-hospital med tech. But oftentimes it's better to keep people out of the hospital to begin with, keep them healthy, prevent things from happening, and that's usually more cost-effective, better for everyone. So that's where a lot of med tech is shifting, kind of keeping people out of the hospital. So a lot of technology is coming home with the patient.
Fantastic. And thinking through any field, there's always misconceptions associated with it. There's going to be people that think, oh, I don't want to do that because on the day-to-day I have to do this, or I really don't want to be getting my hands dirty that much, or it reminds me too much of research. What are some common misconceptions associated with this work?
Oh, that's a good question. Maybe I'll bucket it into kind of two things. One is BME in general, and then one's kind of medtech product development. I think, biomedical engineering is a real broad field. So medtech's like one of 3, 4, 5 different areas. And so that's one of the things that students are often surprised to find out, is that you'll be applying to a job that maybe a computer science student's applying to, but then you're applying to a job that a chemistry student or a mechanical engineering student or an electrical engineering student's applying to. So there's this breadth that we have in BME, which I think can be a strength. Some people view that as a challenge, and I understand that as well. It really depends on what you want to do. If you want to be broadly trained and be ready to solve problems in medicine with a broad skill set, which can be really helpful, then BME is a great discipline. If you really just want to do like mechanical devices in medicine, then mechanical engineering is a great option. So it really depends on if you want to kind of have a broader approach to solving problems or a specialized approach. So that's for BME. For medicine in general, med tech, I would say one of the things that people find most surprising or maybe have some misconceptions about it is just the pathway of bringing a product to market. Most people don't realize that it's on average about a 5 to 7 year process. So we're talking about apps or startups in the digital world. We're talking about months or years. When we get into med tech, we're talking about 5, 10, 15 years of work, and that can be a long haul. So you're typically going into work on something that either has already been started or has been going for a while. If you're around long enough, you'll see something from beginning to end. But usually the time frame of those innovations is what maybe people don't quite understand going into it. It's a slower moving field, more complex devices, more regulation. That said, it's getting better and faster, especially when we have like wearables and things that are more consumer tech. But yeah, that'd be one thing.
Okay.
Yeah.
Okay. I think in a society where we are constantly ramping up production of different items, it makes sense for the wearables. But then telling someone that's already spent 4 years in school, now you're going to get out and you're going to work on something that may take much longer than the time you spent in school. Yeah. Seems a little daunting, but
it can be.
Is it worth it?
Oh yeah.
Yeah.
And I agree. I mean, I will say, as an undergraduate student, I really want to go into medicine. But I realized quickly that my interests, my skill sets, what I wanted to do, kind of the creative building part of me, really lended itself to biomedical engineering. But it's been no less meaningful. I mean, I have many close friends, and I work very closely with physicians and nurses that work in the healthcare space. But for example, the first product I worked in, it was a transcatheter heart valve that I worked in Medtronic. We got that out in about 5 years to get out, but it's now implanted in over 1 million patients. And it's keeping these patients alive essentially day to day. And that's very meaningful. I mean, that technology can have such a broad impact. I don't know if I was a physician, if I, at this point in my life, would have treated 1 million patients. I don't know, but I do think that I've been able to impact 1 million patients through the devices I've worked on and other devices. And I think that is very meaningful. And I think this idea of using kind of creativity and technical skill sets to be able to have a really broad impact on patients' lives can be a very meaningful career.
Thank you. And thank you for sharing that. I think oftentimes we want to attach some sort of purpose to our work.
Yeah.
And hearing that there is purpose and there is value and you see yourself making that impact, I know that makes a difference to our students as they try to decide that pathway.
Completely agree. Yeah.
Now, if that student comes in your office and they're maybe first year, second year, and they're trying to find their way forward, maybe they watched this recording or someone mentioned something about medtech, what would you advise them to do next?
I think one of the challenges is because medical technology is so broad. One of the things that I invite kind of the first and second year students to do is really just to try out different areas of medtech. So there's definitely more research heavy opportunities in medtech, in which case, they should go and get involved in a lab and see what that looks like. I'm a big fan of internships. I really push first year, sophomore, juniors to get out there, see what that world's like before they try and make this decision of like grad school or something else. And then, I really encourage them also to kind of touch the world of like biotech, medtech, digital health, and get a feel for what they want. I'm a big fan of kind of early iterations. I mean, I think that's why you're at a place like Duke is you get exposure, and not to necessarily latch on to, you saw a documentary on prosthetics and that's all you want to do, period.
Yeah.
Like I would be very intentional about broadening my exposure to the different disciplines within biomedical engineering or mechanical engineering or whatever that might be early on, to be able to understand what resonates with you. And then, later on, as you get that exposure, learn about yourself, your likes, your dislikes, also what the market is asking for. So there's been ebbs and flows in biotech and medtech and digital health. Like right now, AI in healthcare is really hot. Medical devices is less hot, but just like 5 years ago, it was the reverse. So just understanding those dynamics before getting too, entrenched in and have your mindset on something would be my primary kind of piece of advice for a new student.
Yeah, and I think that's great because so many students think because everybody around them seems to have their mind made up that they have this pathway and they want to go this route.
Yeah.
So I need to make that decision today.
Yeah.
And exploration is key.
Yes.
Going out and trying out new things, conducting informational interviews, asking questions,
Couldn't agree
exploring, and just really getting their hands dirty in different areas and exploring what it could look like to be in that field.
100%. If I can add to what you're saying, I really like what you said about informational interviews. So one of the things I challenge my students to do is to spend my challenge usually is 3 to 5 hours a week on, if they're looking for an internship or a job, to really just do that networking, do that informational interviewing, and go on to LinkedIn, reach out to people, cold call, and really try and talk to as many people in what they're interested in and adjacent areas as they can, because I think that is where they're going to figure out what they want, and they're going to learn about fields and products and things, jobs, roles that they didn't even know about. So I think it is actually somewhat short-sighted if you come in as a first-year student and be like, I'm going to do this, and just put. I mean, some people maybe that works, but for the vast majority of us, we need to explore.
Yeah, and exploration means going and putting yourself out there. Absolutely.
Yeah.
The other side of things is I often get questions from students about where do I go look?
Yeah.
How do I find people? How to find places? Where do I get information from? Where do you recommend they go?
Yeah, there's a lot of information out there. So I have a few sources that I recommend to students. I mean, one is there's some great online resources for medtech. There's obviously bmes.org and aimbe.org. Those are kind of the academic ones. But then there are a lot of what we'll call kind of industry news sites. So Med City News, QMed, MDD Online, there's a whole bunch of them that really just focus on the industry. They're kind of like a what's going on in the industry, and they'll talk about the latest in med tech and who's buying who right now and how that all works. So I think those are great resources to understand the industry. Then I usually turn them to you all. I say, the Handshake, Career Center resources, Duke resources, in Pratt we have resources as well that we point students to. So there's obviously what Duke can offer. There are some great kind of career fairs around, at BMES. SWE is amazing. There's several others. And then really I push them into informational interviewing. So my party line usually is that I tell them to, I have some lists of medtech companies, and I say, well, you should know these top 10, 30 companies, and then they go to LinkedIn and then they look for connections to those companies, people who have jobs that might be of interest to them, and then they reach out to those people. I always set expectations that, for every 10 people you reach out to on LinkedIn, you're probably only get 2 or 3 that respond to you, just so they know, they don't, just email once out and wait for that response, and try and make a common connection through Duke or someone and then just start that informational interviewing process, and really getting that going, like you said, is uncomfortable, but after you do it a few times, and really after, I always challenge students, I know you all do this as well, when your informational interview, at the end of it, ask, is there anyone else you can connect me with? And then that can just be like an exponential explosion of networking opportunities. So you get going, it's hard, but once you get going, it gets a lot easier.
I try to talk about the 6 degrees of separation, Kevin Bacon, but they often don't know who Kevin Bacon is anymore, so now I'm just like, degrees of separation.
Yeah, that's fair.
Yeah. So kind of the last question here as we close out our time, if there's one takeaway that you would like someone that was listening to this to have, what would it be?
One takeaway for careers in med tech, I would say just a step at a time. So I'm a big fan of trying to explore and just kind of explore the different facets, the different companies, the different areas of medical technology, kind of one step at a time. I think all too often there's just a whole lot of anxiety around, what am I going to do? But really any movement is good movement. And I think with a lot of my students, my colleagues, I think starting early and just pacing yourself, kind of one step at a time, doing an informational interview a couple a week, reaching out to a few companies, putting a few resumes in, that's what I've seen is most successful. And that's probably not unique to medtech. I'm sorry, that's just kind of general advice. There's always this rush, like in March, April, May, to my office of like, oh my gosh, what do I need to do to get a job? What I appreciate more and what I try and encourage my students to do more in fall is really just to kind of just chip away at it and learn about yourself, about your interests, about the industry, build your network, and things usually work out just fine. And even if you are panicking and watching this in April or May, there's still plenty of room, and there's a huge runway out there. So it's nothing to get too stressed about. Just kind of keep on chipping away at exploring and learning.
And we really appreciate the push to us. We appreciate you shouting us out at the Duke Career Center, but also hearing it from somebody that's been in the field that understands that, hey, it's going to be okay.
Yeah.
That this is a process. Yeah. One step at a time, you will find your way. There's a big runway. I appreciate that sentiment as well. I do want to thank our guest, Dr. Richardson, for being here and joining us and sharing his insight into the field of medical technology. This has been Tell Me More About Medical Technology. Thank you for joining us.